There are health benefits to keeping your body up and moving. But this is easier said than done for those with joint problems. How can Filipinos take better care of their joints to manage or prevent diseases like arthritis? Let's get tips from orthopedic surgeon Doctor Gabriel Baluyut. Doctor, thank you so much for joining us. Explain to us briefly, what is arthritis?
Good evening. So basically, arthritis is inflammation of a joint, and most commonly when Filipinos say arthritis, what they're referring to is degenerative osteoarthritis, which is basically wear and tear of our joints.
How does one get arthritis, Doc? Is it in the food that we eat, our lifestyle, or is this inherited genetically from our parents or even our grandparents?
Well, there are a lot of factors. Your family history is a factor, but most commonly it has to do with our lifestyle. So maintaining a healthy, active lifestyle with exercise and a balanced diet is always good to try and prevent that wear and tear eventually. Also, when we talk about gouty arthritis, which is elevation in uric acid, you want to avoid certain foods like excessive intake of alcohol, uric acid triggering foods like laman loob usually, isaw, kidney, liver, things like that.
I'll talk to you about gout in a while, but at which age can we be hit by arthritis and gout?
Yeah, so for osteoarthritis, degenerative osteoarthritis, it's usually at a later age when we're in our 50s, 60s, but gouty arthritis can attack anytime actually during adulthood.
Because I've met several people who are in their mid-30s and they're in pain because they've been hit by gout. Can you really get it that early in your age?
Yeah, so if you are predisposed to gouty arthritis and you're eating a lot of the food that we're trying to avoid, even at a young age, you can already have your first attack.
And arthritis and gout, Doc, is it more common among women or men?
Well, actually, it can occur in any males or females. It really depends on a lot of it is what you're eating, how you're treating your body. So there are research that says there's slight predisposition, but I encourage my patients to just say, all of us are at risk and we should all be trying to prevent it as much as possible.
Is there a cure for this?
Well, in a way, yes, but there are tiers to the cure. I personally would encourage people to go for prevention instead of cure, because sometimes finding the cure isn't as straightforward as we might like to hope.
But of course, you say, Doc, prevention, pero a lot of our kababayans want all the bawal foods, right? And all the bawal drinks. That's why they're hit by arthritis and gout. And sometimes they just can't control themselves. So they take painkillers and medication. At this point, what is the best painkiller or medication that can prevent the pain or ease the pain for arthritis and gout?
Yeah, well, definitely, if you are experiencing pain on a regular basis, I definitely encourage you to see a doctor and not try and medicate on your own. But first, initial treatment, you want to be taking some sort of anti-inflammatory medication. Something over-the-counter that's available is mefenamic acid, naproxen, things like that. But definitely see your doctor, and I'm sure they'll be able to help you much better.
Okay, right now we're seeing maybe a patient who has been hit by gout. No, how long does it usually impact you? Is it just hours or can it be days?
It can definitely be days, especially if it's a strong attack. So it usually occurs very suddenly overnight. You're from zero pain to intense pain. And once that happens, you definitely want to see consult, because delaying treatment might lead to a longer period of being in pain.
And I want to consult with you, Doc. I'm 56 years old. I don't really eat a lot of fatty foods. I don't drink. I don't smoke. Can I still get arthritis and gout at my age?
Yeah, well, gout, it would depend. You're at the age that if you haven't had an attack yet, that's probably a good sign. But when we're talking about arthritis, degenerative osteoarthritis, which is wear and tear, you're actually at the age that we begin to be a bit wary, and we're hoping that in the next few years you don't develop arthritis.
And what is usually the safe age in the 50s and 60s for an individual not to get arthritis or gout?
Well, there's really no safe age. There are many patients who, even at a very advanced age, they thought that they'd never have arthritis, suddenly develop arthritis. So it really depends person to person. I wouldn't say that there's a particular age that once you get past that age, you're in the clear.
And for our viewers, once again, how can we best manage arthritis and gout? Exercise, physical therapy, of course, lifestyle modifications, right? But what if they cannot control these lifestyle modifications? What should they do, Doc?
Yeah, well, definitely they should see their doctor, get advice from their physician. There are lots of things that we can try and do that are personalized to each and every patient, depending on what they're feeling, what their risk factors are, what are the causes of the pain. So it would really depend, but definitely when in doubt, you want to have a healthy diet, you want to be engaging while you're young in exercise that can help lubricate and provide nutrition to the cartilage of our bones, and avoid a sedentary lifestyle.
So the key here is don't self-medicate. Always see an orthopedic surgeon, doctor like Gabriel Baluyut to give you the best advice for your arthritis and for your gout. Thank you so much for joining us on The Final Word.